To our next item, and that is the Berks County COVID-19 data report. We have Brian Gottschall, our director of the Berks County Department of Emergency Services, to present. Brian.
Good morning, commissioners. Sorry, trying to get used to the new interface here. Red boxes, purple boxes, everything has changed. So I think we're showing the slideshow now. Our first slide that we want to take a look at is our cases and testing. 14-day smoothed on cases, 7-day on testing. We continue to see a great downward trend on the right-hand side of the slide here. In fact, our case count is now actually below the 210 smoothed cases that the Department of Health had offered as our goal. I do want to mention on this slide, though, one quick thing. I've talked to people about getting vaccinated, those that have still not been vaccinated. And one of the things that I've heard from people is, well, you know, we really don't need to. We were studying it. We were thinking about it. We were thinking we might do it later, kind of in a wait and see attitude. But now we're over the hump and the pandemic's over and our case counts are way down. And I just want to illustrate to people the difference between where we were June 29th, 2020 on the left-hand side at the top of the slide and where we were June 29th, 2021 on the left-hand side at the bottom of the slide. And the reality is that we're almost at the exact same place. Now, it's important to remember, you know, last year we had no vaccine, but our case counts were way down due to the seasonal changes. And we're seeing very similar numbers this year. It also is important to recognize that, as we see here, our hospital numbers are very low, significantly below where they were in June of last year. Our deaths are much lower, significantly lower. We're seeing a death maybe every 2 to 4 days, and we've gone a period of at least 11 days with no deaths. So this is all great news, but I really do want to emphasize to people that the outcomes that we're seeing are as a result of the vaccinating effort. And I would hope that if people are still looking at getting vaccinated, and they found comfort with the vaccinating process, with where we're at today, and they would otherwise be willing to go and get vaccinated, but don't believe that they need to any longer due to where our case count is at, that they dispense with that type of thinking. Again, very personal decision. Everybody's going to make their choices on their own, but please don't defer or avoid getting vaccinated because of where our case counts are, because unless individuals continue to get vaccinated, we could see ourselves facing another case count rise in the fall, and those who have not been vaccinated continue to be exposed to the risk of serious illness and death. So I think I talked about our death slide already as we kind of walked through that. Again, very flat curve here. We're great news with respect to those having serious illness or death due to COVID. On our vaccine administrations, we remain number 9 in the Commonwealth, as we've said, where we expect to remain due to our population. There was no change over the last week in our per capita numbers. We continue to be 30th in the Commonwealth as far as fully vaccinated and 23rd among those with at least first dose as of the end of last week when DOH published this data. Looking at the CDC data, Pennsylvania is at 60% of the entire population fully vaccinated. Again, our goal being at least 70% of adults fully vaccinated. In Berks County, we lag behind that at 53.8% of our population fully vaccinated with the same goal of 70%. This has really flattened out over the last week. We were seeing some decent gains in reducing our how many new people we need to start getting vaccinated week over week. This is a change of less than 1,000 people in the last week. So we're really starting to see these numbers flatten out. If everybody who was already vaccinated with at least a first dose finished up, we would end up at 65.2%. In Berks County, we're looking for about 16,000 new people to start this effort in order to reach that 70% goal. Again, numbers getting very flat week over week. Commissioner Barnhart, of course, is going to discuss the clinic report, but we want to remember that there is an opportunity to either schedule or walk in at a number of locations in Berks County, inclusive of the BCHC County Co-operated Clinic in Muhlenberg Township next to Walmart. While we have passed the threshold to start new Moderna vaccines at that location and be able to finish them at that location due to the 4-week difference between the first and second doses, you can still start a Pfizer regimen there, and Janssen will remain available throughout the entire operation of the clinic until it closes in the end of July.